Welcome to the SIBO Doctor podcast with Dr. Nirala Jacobi. If you're a practitioner and want to learn the basics of SIBO, head over to SIBOTest.com and sign up as a practitioner. This will give you access to a free 90-minute webinar on the fundamentals of SIBO treatment. If you're a patient, please know this information is not intended to diagnose or treat a medical condition. Please ask your doctor before initiating any new treatments. And now, over to Dr. Jacobi and the SIBO Doctor podcast.
If you're like me, you're finding that treating small intestinal bacterial overgrowth can be complicated. Patients often present with a myriad of symptoms and associated conditions which require holistic thinking and a methodical approach to treatment. This podcast was born out of a desire to start a conversation with other practitioners, educators, experts, and researchers, and see if their insights can give us new treatment considerations, especially for our difficult cases. In this podcast series, our guests talk about functional gut disorders, hormonal issues, the enteric nervous system, food intolerances, the immune system, the microbiome, methylation and genomic issues, and everything else that can make a SIBO case very confusing. I believe that by understanding the often complex interconnection of SIBO with other disease manifestations, we can be more effective in our treatment approaches. I hope you find this podcast useful in your practice, and thank you for listening. Greetings, SIBO practitioners. With me in the studio today is Carly Woods again, who's a naturopath who's recently graduated and works here at SIBOTest. And we thought we'd do a podcast today about testing, because we always get a lot of questions about how to interpret tests, what tests should I order for the patient. All those types of questions should be answered today. So welcome, Carly.
Awesome. Thanks, Nirala. Hi, everyone. So let's start off with something like, what is SIBO breath testing to begin with?
So SIBO breath testing came about from carbohydrate malabsorption testing that's been around for quite some time. And the premise is that you have a patient go through a period of overnight fasting, and in the morning they do a baseline breath test and they consume a substrate such as lactulose, glucose, or fructose. And then you are measuring breath samples every 20 minutes for about 2 to 3 hours, depending on the lab. And the idea here is that we are looking for bacterial fermentation, because bacteria utilize these substrates to produce either methane, as in the case of Methanobrevibacter smithii, or hydrogen, as in the case of other bacteria like Klebsiella, E. coli, those kinds of organisms produce more hydrogen. So by capturing the breath, we can actually determine the levels of hydrogen and methane, and if it's a certain amount within 90 to 100 minutes, we can deduce that this is bacterial fermentation, because bacteria and archaea are the only organisms in the human body that produce methane or hydrogen. So it's a great way and very easy for the patient to do at home. So that's one of the reasons it's become very popular for SIBO testing. But basically also, when you consume those substrates, it gets, as I said, it gets fermented into hydrogen or methane. That then gets absorbed into the enteric circulation, which gets carried to the lungs, and you then exhale the hydrogen or the methane, and that's what we're capturing and analyzing.
Yeah, awesome. So can you talk to us a bit about how does a person actually perform a breath test at home?
Sure. So what we do, we have a pretty stringent prep diet, and there are certain prep that you need to make your patient aware of, such as if they've had a colonoscopy within a month, it's not a good time to it's it's important to wait a month before you do a breath test. Also, if they've been on antibiotics, you want to wait about a month, or herbs about 2 weeks, probiotics about a week. So there's certain parameters that you want to be aware of so that the patient can do the test at the appropriate time. So then if they're constipated, they want to do a prep diet for about 2 days before the test. And that consists of an extremely low fermentable diet. That's basically just chicken, rice, olive or coconut oil, and eggs. That's it for about a day or two, and overnight fasting before the test. And then when they get up in the morning, they want to move around a bit for 20 minutes, and then commence the testing by doing the baseline test, then drinking the substrate, and then testing every 20 minutes with the breath collection device and the vacuotainers.
Awesome. And so there's a video that SIBOTest has produced that runs people through that. Where can people access that?
Yeah, so we had so many people ask us how to do it exactly, because one of the things as we know as practitioners, many times patients are quite brain fogged and can't really follow the instructions correctly. So we did a demo video which is on SIBOTest.com about the breath testing, and you can watch that, how to collect your samples. And that's really reduced our level of incorrect sampling quite substantially.
That's really good. I'll be sure to put that in the show notes. So if anyone's looking for that video directly, you can just go to the show notes and find it there. So how would a practitioner know what test to give to their patient, lactulose, glucose, or fructose?
So, there's no perfect test for SIBO. Breath testing, lactulose is, according to the literature, anywhere between 50 to 75% accurate. So, which is fairly standard, and glucose is a little bit more accurate. But the problem with glucose testing is that glucose is a normal substrate that's absorbed by the body. So it's usually absorbed within the first portion of the small intestine. So if somebody has distal SIBO, that would not be captured necessarily by the breath test, by the glucose breath test. Lactulose, on the other hand, is not really absorbed by the human body and is very readily fermented. But it also is something that stimulates peristaltic action, so it will influence transit time. It's sold also as a laxative, so it's important that whatever lab you use only 10 grams of lactulose. If you go much over that, as I've seen other lab reports where more lactulose was used, and you would suspect then that you might have some influence on transit, which of course would then also potentially influence your test results. So lactulose is this sort of baseline testing that we use, which means that if that's positive within 100 minutes, you're pretty sure, meaning that you have either an elevation of hydrogen and or methane, that's considered positive for SIBO. And some practitioners prefer to do a combination test, meaning that they have the patient order a lactulose and a glucose test kit. So the patient would do lactulose first, then go back on the prep diet for the remainder of the day, and then have an overnight fast, and then in the next day they would do the glucose test, so that we see if lactulose was not fermented by those bacteria, then there's also a chance that glucose might actually be positive. And that's based on that some bacteria do not ferment lactulose. And sometimes when we see an all-negative test and a patient is hugely symptomatic for SIBO, we do recommend following it up with another test to see if their particular bacterial dysbiosis in the upper gut is actually more captured with a glucose test or a fructose test. And fructose, there is a condition called fructose malabsorption, which is very it's very prevalent in the European population where those glucose transporters are very easily overwhelmed by fructose in that population. And however, we also use fructose as a substrate, so which means that if you have a lot of fermentation with fructose, that could also be construed as positive. And we're in the midst of designing a study that looks at using fructose as a SIBO breath test, and then using SIBO treatment, and then seeing if fructose malabsorption is actually resolved after SIBO treatment.
Oh, that's interesting. Huh. Okay, cool. So I know that there's hydrogen and methane that's produced and measured. There's also the third gas, hydrogen sulfide. Yeah, so, but no, there's no testing for that currently, is that correct?
Not currently. There are, I think that the technology will be available soon, would be my guess. Yeah.
Awesome.
So that's a different test. So if we look at a test result from a patient and you have a 3-hour breath test with samples taken some labs do 15 minutes, some labs do 20 minutes. So every 20 minutes you should have about 10 samples to look at. And if all those samples are zeros and ones, then there is some thought that could indicate hydrogen sulfide, that the flatliners, as we call them, might, where we don't see any rise at all, might actually be hydrogen sulfide.
And so if someone comes out as a flatliner, and they're showing a lot of symptoms of SIBO, would you recommend just going ahead and starting the treatment with biphasic diet? What sort of would be your...
The interesting thing about the hydrogen sulfide is that the organisms, the Vibrio, sulfa, and Biliophilia, that produce hydrogen sulfide, they really love a fatty diet and high protein diet, which is of course the SIBO diet. So there is some idea, and this is sort of is still, we don't have all the understanding yet as to what to say, but still very much a low FODMAP diet. When I see that, and I really suspect hydrogen sulfide, which has, like classically the patient will talk about extremely foul gas, also burping, sort of very sulfury burps. So you will have that. If you don't have that and you have a flat line, that might just be a non-fermenter for lactulose or so, and I would suggest following up with another test. I would expect those kinds of symptoms with the hydrogen sulfide. So before you go and change a lot on the biphasic diet, I would really kind of make sure that that's really the case.
Yeah, awesome. That's good. Be comprehensive. So, okay, so let's just go back to performing the testing on people. Is there a difference for when you're performing the testing with children?
So children, the only problem with that is that they need to be able to control their breath, because if they don't, then false or invalid samples are likely. So, and usually what we recommend, you can do little tricks like, children below the age of 5 that have a little bit more difficulty with this, because the breath testing itself is super simple, right? It's super simple to do. You basically are breathing into a bag that has a hole in it, and you have a steady breath, and then you have a glass vial that gets punctured with the collection device where you're sampling mid-breath. That's what you're doing. And with children below the age of 5, you can practice with blowing up balloons and, those kinds of things that really teach children how to do a steady breath. They don't want to do a really deep breath and then forcefully exhale. They just want to do a normal breath, like with blowing up a balloon would be a good example. So we've done children age 4. I would... it's more difficult, less than that, but any child that can control their breathing, they can do this test.
Okay, great. Someone's performed the test. Do they need to get it back within a certain time frame in order for things to be viable?
Yeah, and different labs have different, one of the things is we all are using the Quintron breath tracker. That's pretty standard equipment. It's the gold standard for breath testing. It's highly, highly accurate. And every lab I know uses these breath trackers. And basically, different labs have different collection devices, so right. So you want to ask your lab: are you using the vacutainers, the glass vials, or are you using what's called an open system? And the open system uses bags that the patient just breathes in and then uses a stopper, right? So like it's a little bit more cumbersome and has more room for collection error. So we're really very adamant about using the Quintron breath testing kits that come with the vacutainers. So wherever you are in the world, you might want to ask your lab how many grams of lactulose you're using, how many grams of fructose and glucose. And on the SIBOTest.com, we have a good chart that kind of gives you some idea as to what to ask your lab. So you might want to go to SIBOTest.com for that, because I think there are different well, I wouldn't say criteria, but different labs use different techniques, although we all are looking at the same thing. So we use the protocol from Dr. Pimentel through Cedars-Sinai group.
Awesome. Okay, so I'll be sure, just so people know, I'll put that in the show notes, the link to the questions to ask your lab. So that'll be easy for you to go to. So you spoke before about the pattern that you would see that would indicate hydrogen sulfide being a flatlining test result. What sort of other patterns would you see on test results, and what would they indicate?
So typically let's just talk about what constitutes a positive and what sort of constitutes a borderline, and then we can move into that. So for hydrogen, what you're looking at, whether that's for glucose or for lactulose or even fructose, is you're looking for a rise of 20 parts per million over the lowest preceding reading. So let's say baseline was 5, then at 20 minutes in, it's actually 2. Then you would use the 2 as the lowest level reading, and then you want to have a rise of at least, or a reading of at least 22 for hydrogen to constitute a positive by about 100 minutes. Some labs do 120 minutes, which is a little bit, we read that as borderline.
Okay.
Right, so borderline is up to the practitioner to interpret that. If the patient did not have diarrhea, is in fact more constipated, has very classic symptoms, they may actually be positive at that point.
And so in the same respect, if someone had diarrhea during the test, would you shorten it?
Depends if it depends on the severity of their symptoms. If they normally have diarrhea, but it's 80 to 100 minutes is you're pretty safe that's the small intestine. So I would say yes, that's you're safe within that parameter. And so for methane is a bit tricky because a lot of people have methane. Right, there are a lot of samples come back with high methane, methane that stays high, and methane that rises. So let's talk about that, because that's a really important differentiation between something like SIBO and something else. So methane, you still want to see a rise, meaning that let's say your baseline is 20, which is quite high, right? Dr. Pimentel has always said that anything over 3 parts per million for methane and they're constipated is positive for SIBO. That's now been revised to some extent to is 10 or less. So, but let's say somebody comes in with a baseline of 20 and then hovers around the 20, 22, then goes back to 20, then maybe up to 23, then goes back to 20, really hovers around the 20 all the way through the test. A growing body of practitioners is now saying that that's something different. That's reflective also of large intestinal population of Methanobrevibacter. So it's not just small intestine, right? So, and the reason for that is we still want to see a rise in the small intestine, meaning that if you have, again, a baseline of 20, you want to see a rise of at least 12 parts per million within the first 80 to 100 minutes. And if you do have that, if you have then a 32, that is still SIBO because you're actually fermenting that substrate.
Yeah, okay.
Right? And then we also have a combined reading. So if you don't quite have 20 for hydrogen and you don't quite have 12 for methane, but together the rises of each respective gas is a combined reading of 15 parts per million that can also constitute a positive.
Mm-hmm. And
reading.
So that is because the hydrogen are feeding the methane?
Yeah, so the way hydrogen is produced by Methanobrevibacter is it utilizes 4 hydrogens to make 1 methane. And so one pattern that we do see is when we start, let's say a patient is positive methane, again, a reading of 20 at baseline, then at, let's say, 20 minutes they're 30, and then at 40 minutes they're at 35. So a rise of 15 positive. You're treating that patient with either a herbal preparation or rifaximin neomycin combo. You often then see on a retest that the methane is very low, but now the hydrogen is high. And that's because you've stopped methane from utilizing 4 times as much hydrogen to make a methane. So now that's a very common pattern that we see, that now it's time to treat your hydrogen producers.
Cool. Okay, that's really good. I'm just interested in the reference ranges and is there like a consensus globally on you were speaking before, Dr. Pimentel was saying now it's below 10. That's regular for methane. Is there like a global consensus on?
There is not, unfortunately, but there is more of a North American consensus about breath testing in general, that lactulose is a good test. Well, it's a usable test for the diagnosis of SIBO, and also I like to stick with that guideline of having it by 100 minutes. Anything beyond that is really up to the practitioner, because there are labs that use a 3-hour breath test, and that's by the 3rd hour it's a bit questionable. But if you're the practitioner and you have a patient that virtually has no movement whatsoever, now bearing in mind that upper gut motility is very separate and very different from peristaltic action of the colon, so you can't always determine that. But it's that part is up to the practitioner. We are desperate for a consensus in this. Generally, there is a consensus, but it took a long time, even for labs here in Australia, to offer lactulose testing only, because they just didn't subscribe to that idea. But now a lot of labs are looking at lactulose only as a test. So that's an example of how it's gained more popularity and more consensus within the gastroenterologic sort of community.
Yeah, that's great. And so, okay, so someone's had their patient tested and they've gone through some treatment. How do they know when to retest, and do they want to retest?
That's a really good question. So what we say is that, and this is based on the algorithm that Dr. Pimentel had an algorithm, and then Drs. Alison Siebecker and Dr. Steven Sandberg-Lewis came up with also sort of a parallel one with where they inserted a lot of the herbal treatments and stuff. But the consensus in the integrative community, I'd say, is that after you've tested your patient positive, you're treating, you want to gauge how they're really doing. If they're 80% better by the end of the treatment, and that could be depending on how long your treatment is, if it's 6 weeks, 8 weeks, or whatever. Also, depending on how high the gases were. With every, methane, we can say that with every treatment round, you will reduce methane by between 20 and 40 parts per million, roughly. So if you have very, very high methane levels, you already know that you're going to have to do likely a couple of rounds before considering retesting. I'll say something about the methane spot test in a second. But so let's say that you've treated your patient and you're saying, all right, well, let's reassess. And they say, Doc, you're a genius. I am completely cured. I have no more symptoms. You do not need to retest that patient.
Great.
Right? You might just actually then, depending on how they are doing, just maintain them on a prokinetic, maintain them on the biphasic diet, let's say 3 months or so. And then if they've had no relapse, you can start to reintroduce FODMAPs into their diet. But let's say that patient comes back after the first treatment round and saying, I feel better, but really there's still something going on. You do want to retest at that point because you need to know if your therapy is actually working. But let's say you retest and lo and behold, SIBO is totally resolved, or your test comes back now negative and yet the patient is reporting that they still have symptoms.
Yeah.
So you have two choices. Either you say, okay, maybe we killed all the bacteria that were fermentable with that substrate, or it's something else in addition to SIBO. This patient had SIBO, but now we've treated that layer, but we need to dig deeper and we need to look at maybe large intestinal dysbiosis or the plethora of other conditions that can cause symptoms like SIBO. So it's a really important point because a lot of people just say, well, I'm just going to keep treating, and it's just a really bad case of SIBO, and then 3 months later, the patient is still not really improved. So it's, again, that's a total practitioner call as to when to retest, but the important point is if your patient is dramatically improved, there's no need to do that because you've treated what's wrong. But if they're not, or if there is still, but like they're about 50-60% improved, but they're still struggling, then I would definitely recommend retesting, because if you might have a case where that particular therapy is just not effective. And I've seen that in many cases, because I see more advanced cases of SIBO and I get a lot of referrals, and I see where they've done exactly the appropriate treatment for their patient, absolutely textbook SIBO, they've treated them with absolutely the right medicine, and they retested and nothing shifted. Right. So that's important, So retesting is important for those patients that do not improve. The other thing is, if you have methane dominance, and you have a case of methane high throughout, so a high baseline that doesn't change very much, beginning to end, that patient, you can easily do a methane spot test, which we offer here at SIBOTest. It's just a 1 vial test tube that basically compares baseline to another baseline. So if that patient was, again, 20 and you're treating, you can easily do a 1 test vial sample to compare it to see if they're still actually high baseline, because that can give you a good indication of whether or not your treatment is working. It is not a good test. The methane spot test is not indicated for patients that have a rise with methane, so a classic SIBO methane case.
Oh, I see. Okay.
So it's only for those that have a high baseline that stays high. But it's great because it's only $50 and it's a lot easier for the patient, and you can clearly see whether or not your treatment is working.
Awesome. That's fantastic.
You do that about 3 weeks. I usually do that 3 weeks into treatment.
Okay, cool. All right, so we have the first question here written in, says, in regards to visceral therapy, what do you see change and how long does it take to change? Does the visceral therapy correct the problem, or do they need to have regular treatment as ongoing management? And we'll probably need some background on what visceral therapy is. Please.
Yes, I'd say. So visceral therapy, I think in this question would refer to the visceral manipulation that we recommend for people that have adhesions from whether that's endometriosis or abdominal surgery, but adhesive disease that basically restricts the small intestine, and that patient's SIBO may actually be secondary to the adhesive sort of disease or adhesion disease. So what we usually recommend is finding a good visceral manipulation practitioner that's trained in a particular technique called the Barral technique. In Australia, we don't have physical therapists that were trained by the Clear Passage outfit in America that has extremely incredible results with resolving adhesions. they have a very specific technique that they train their physical therapists. It's not something that can be trained. They don't. You can't just go out as a physical therapist and learn that particular technique without going through them. That's called clear passage. And so, but because we needed some substitute or something to offer our patients, I often talk about Alyssa Tate in Brisbane, who really told me about this particular technique that she uses that seems to be very effective, and I have seen this firsthand with my patients that yes, it does work. And a bit of background here: if you have a patient that you know has restrictive disease because of even cholecystectomy, cesarean, endometriosis, laparoscopic laser surgery, any of that would indicate adhesions. You really want to find a visceral manipulation therapist that's very good with this technique, because if they are just doing abdominal massage, you run the risk of triggering even more scar tissue formation. So it's an important thing to know. And what I can do in terms of answering the question is a bit difficult, because it depends on the type of therapy that's being used. But it's my understanding that this very gentle technique serves to very, very, very gently break up the scar tissue without triggering further scar tissue formation. So it really depends on the severity of the adhesions. That will determine whether or not this person can, how long it would take for the therapy, and if it returns. It's really depends. I would say speak to or make connections with a visceral manipulation therapist that's trained in the Boral technique, and really talk to them about this. I have seen people only need 3 treatments and derive great benefit from that. So it's a more individual case-by-case situation, and I don't think I can generalize with answering that question more than what I have now.
Oh, that was good. Thank you. That was a great answer. All right, so I've got another question here. I read a study in which patients with SIBO were given an FMT via nasogastric tube to help eradicate SIBO, as diagnosed by a lactulose breath test. In 5 out of 7 patients, after 8 weeks, another lactulose breath test showed no signs of SIBO. So the question is, do you believe that an FMT administered by nasogastric tube into a section of the small intestine could benefit and even eradicate SIBO?
It's a really interesting question. And first of all, I want to mention that it's an extremely small study size, right? And if you think that, if you start with the idea or the knowledge that your patient may have post-infectious IBS, meaning they had a case of gastroenteritis with, let's say, Campylobacter, and that is what triggered their SIBO. So they have a damaged migrating motor complex. They cannot clear bacteria out of the upper gut. I really don't think that FMT would be a good solution for these patients, because they just can't clear bacteria. SIBO is a disease of, or a condition of normal commensal bacteria that are translocated into the small intestine. So I'm not categorically saying that I don't think that would work, because I think that there is room for maybe coming at it from a different angle also, is that what we know from Dr. Pimentel, who's mentioned it at the global outreach on IBS last November. He mentioned that, I'm not sure if it was him or one of the other doctors at Cedars-Sinai, but there are studies that look at the species diversity in the small intestine, right, in terms of bacterial growth. There are supposed to be some bacteria there, just not greater than 10,000 organisms per gram. If it's greater than that, it's a diagnosis of SIBO. But when they look at the species that are there, that are meant to be there, if a patient has a very low index of diversity, meaning that they don't have very many species in the small intestine, they're at a much higher risk for IBS, independently of SIBO status. But if they have a higher level of diversity, they are less at risk for IBS. So I think there's a lot that we don't know yet, is my sort of roundabout answer to this question. I think it's a fascinating study, but I also know I talked to Mark Davis, who's a naturopathic physician in America who specializes in FMT treatment. He's sort of a naturopathic gastroenterologist. And he talked about that if you actually use nasogastric sort of transplants or implants, I should say, in the small intestine in a healthy individual in the small intestine, and you come back a week later or you do a breath test, there's just virtually no SIBO. You cannot cause SIBO with that in a healthy individual because of the motility in the upper gut, and it demonstrates the incredible effectiveness of the cleansing wave of the small intestine, clearing out, sweeping out the bacteria that are there. So, but in somebody who's got a damaged migrating motor complex, I really think, just from an anatomical perspective, if you've got really slow motility, how are you going to get rid of those?
And so just to remind everyone who's listening, where can they order a test from with SIBOTest?
SIBOTest.com. And so if you have a patient that needs a breath testing, you can just send them to us, or if you have a local lab, But basically, we ship out internationally, but if you have if you have a local lab, that's obviously very acceptable. And so we have a lot of resources on our website for practitioners. The biphasic diet is there, other handouts, a lot of tips for the patient, cookbooks, etc. So it's, even if you don't do testing through us, I think it's a really good educational resource for you and your patient. So have a look at it if you haven't checked it out yet. A
lot of which is free, might I add. You just give out a lot of free resources there,
which
is fabulous.
Yeah, we do. We've been involved in SIBO for so long and it's constantly getting updated. We keep really up to date with our information. So we're going to do another SIBO. Every year I do a sort of a synopsis of what's happened with SIBO, and the next one I think is in June. So if you want to sign up for that, it's fairly inexpensive to get sort of a good hour-long what's happened in the world of SIBO update webinar.
Awesome, that's great. And if anyone has any questions that they'd like to write in to me, you can access me at carly@SIBOTest.com and write in any questions you've got about SIBO testing, treatment, anything like that, and we will do our best to put it on the show.
Great.
Oh, and that's CARLY @SIBOTest.com. So just before we check out for the day, so you're speaking soon at the SIBO Integrative Conference in Chicago. Do you want to have a quick chat about that?
Yeah, and actually I interviewed Audra Mehan, who is the organizer of that conference. So stay tuned for in the next 10 minutes. It's going to be all about that conference. I'm really excited to go. I will be presenting on the biphasic diet and also herbal treatments for SIBO and SIFO. But there's going to be, it's like a truly integrative symposium for SIBO. So we'll be talking about methylation, there'll be dermatology and SIBO. It's going to be an incredible conference. Wow. So listeners, stay tuned. It's coming right up, just 10 minutes. I think I just had 10 minutes with her, so she'll be telling us all about the conference, and you can tune in via live webinar as well. So,
oh, that's exciting.
Yeah. So thanks, Carly. Awesome. See you next time.
Thanks, Nirala. See ya.
Today I'm speaking with Audra Mehan, Dr. Audra Mehan, who is the conference director, CME, for the Integrative SIBO Conference in Lombard, Illinois. That's coming up very, very soon, March 25th and 26th. And I just thought I'd take the opportunity to have a brief chat with her about the conference and how people can sign up and listen in via webinar. So welcome, Audra.
Well, thank you for having me, and hello.
Can you tell us a little bit about the conference?
It's a new conference. It's going to be unique. We went at SIBO with a little bit of a different perspective than what we had seen in other conferences so far. We recognize that this is still a relatively new topic in the medical field, and in the last couple of years, it seems like there has been more and more information being generated and being presented all across the world. Now that you guys have your show taking place in Australia. So it's internationally recognized, but one of the things we really wanted to try and offer with this conference was an integrative perspective. So as the conference director, when I started going in looking for speakers, I looked for anybody who could put a different spin on things. So I wanted somebody who could relate not just the basics, which is, the rheumatology. A lot of people want to talk about the diet, treatments, some of the protocols. But this time I also looked for speakers who could bring up other topics such as dermatology, genetics, restless leg, diabetes. I did actually try really hard to find somebody who would talk about SIBO and autism, because I feel like that is still a link that needs to be recognized. But it's difficult finding somebody who can declare themselves an expert in two very distinct areas like that, that is still comfortable talking with that confidence on two topics. So I'm still looking for that one. But the idea is that we want the practitioners who are coming in from those different areas to come in and start looking at it from the other side. So, if you have a patient that's coming in and they've been getting treated for acne for the last 10 years and getting nowhere, and all of a sudden they land in your office and you're looking at them maybe as a naturopath thinking like, this isn't just acne, this is absolutely gut related. So, what are the chances that gut issue that they're struggling with is SIBO? There's a pretty good chance that SIBO is involved there. So that's what we're trying to get across in this conference. It's just like that kind of broad perspective and the depth in terms of diagnosis and treatment when it comes to SIBO.
That's what I'm really excited about, because I think as integrative practitioners, whether we're naturopathic physicians or integrative GPs or integrative medical doctors, we're sort of we understand all the interconnectedness of multiple systems. And that's really actually the whole ethos behind this podcast, is to combine or to look at all of these different aspects or a condition from lots of different aspects. And so I'm really happy to see that that's finally happened in a conference where we see we have Dr. Paul Anderson talking about methylation. We have lots of different speakers. Michael Traub, Dr. Traub, talking about dermatology and the manifestations of skin disorders and the connection to SIBO. So just really happy to see that. Can you talk a little bit about the other speakers?
Oh my goodness, I can talk for days about these speakers. So I have worked with many, if not all of these speakers on multiple occasions over the last couple of years. And they, these people, they are not only experts in their field, but they are so passionate about what they're learning still. If nothing else, it's a journey for them. And so when I put them on stage in front of a group, they have this way of getting everybody else excited about gut disease, which if for people that are in GI, it's a very exciting topic, but for people that are not in GI, it's kind of like, this is the last thing that I want to talk about before I go and have lunch. But these are people who can sit there and talk about lunch and talk about bowel movements while eating lunch, and they're still super happy to be there. Totally. And they're so happy to work with other people. So I found a chiropractor down in Southern California who's doing similar things. He actually, I think, has his own program that's going to be developed here in a little bit. We have a couple of acupuncturists who are coming in to speak. I have Carmelo Scarpignato coming from Italy. And this guy he's a walking encyclopedia. I don't know how else to describe him. He is an educator through and through. In his heart, he just loves building awareness in people. But he has spent pretty much his entire life studying this stuff. More letters behind his name than I can count or ever remember.
And he wrote three books on rifaximin, so he's truly an expert and a real expert on rifaximin. If there ever was one, he would be it.
Only 3 books? No, I'm kidding.
I mean, like on one antibiotic.
And then also I have Heidi Turner. She's coming from Seattle, and she works mostly with diet and rheumatology. And I mean, the first conversation I had with her, we talked about just a lot of people that will come in with depression. They'll come in with depression or anxiety, and they're on all these medications to try and treat insomnia and all these other things. And she said, what it comes down to a lot of times is gut. But then you have to start wondering, like, what comes first? I mean, is it the anxiety and the depression that came first, and that somehow transferred back into maybe like pH imbalance that created a perfect environment for SIBO, so now they're working with SIBO as well? Or was it SIBO that came first that created some sort of malabsorption issue that is now triggering that gut-brain reaction? So, I mean, these people, like, they all have their own different perspectives, and getting them all together in a room is just, it turns into this enormous amount of energy around this topic. So.
Yeah, and Heidi actually was on the podcast talking about mast cell activation syndrome and SIBO. So had a fantastic chat with her. So I'm really happy to meet her in person finally. And I'll be on the show, on the SIBO show there, and talking about the biphasic diet and food intolerances. So hopefully I can contribute my bit to the mix of excited chatter. And can you tell us, like, how do people, if they can't be there in person, first of all, where is it? Are seats, I know they're filling up really fast. Can people still get in? Can they just join via live webinar? How do people connect?
Absolutely. We still have seats available if you want to come in person. I recognize that Chicago area and Illinois is probably not the place to be at the end of March. Fortunately, the conference is inside, so everybody will be warm. But if you want to attend by webinar, that's also available, no problem. To register, I would recommend going to our website. It's www.synergycmegroup.com. And that will have all of the information on it regarding the conference location. You can register online. It'll tell you about the CEUs that we have offered. There are speaker bios on there, the speaker pictures, their overviews. You get an idea of what everybody's talking about. You can see the conference program. Some of the speakers have done brief interviews on Facebook so far. So they have like little commercials about what they're going to be talking about, and you can see that as well. And then you can also take a look at all of our sponsors that have jumped on for the conference. And get a little bit more information regarding like what's out there in terms of treatment and who's supporting the research.
Great. Thanks so much, Audra. Looking forward to see you in about 3 weeks' time. And hopefully a lot of people will have the link to the conference on the podcast page. So just click through and hopefully join us via live webinar. And I will see you in 3 weeks, Audra.
Awesome. Thank you, Nirala.
Thanks a lot.
Thank you for listening to the SIBO Doctor podcast. We hope you found the information in this episode useful in the treatment of your SIBO patients. Head over to our sponsor, SIBOTest.com, an online testing service for your patients and home of the Practitioner Education Portal. Tune in again for another episode of the SIBO Doctor podcast. Thanks again for listening.